Great. Thanks, Anthony. This is a picture of my daughter, Natalie. She's 2.5. It cost me over $100,000 to conceive my daughter. Not only was it extremely expensive, it was a really difficult process. 2.5 years, 6 rounds of IVF, 3 miscarriages. At any one time in the US, 1 in 8 couples are struggling with fertility challenges, and many of them can't afford or know how to get treatment and care. Fertility is already a big challenge, and it's getting worse. Women are choosing to delay childbirth into their 30s, which has a number of advantages: opportunity to focus on your career, your relationships, your financial readiness. But biology is not on your side. Meanwhile, male sperm counts have actually decreased over 50% in the last several decades. For those of you sitting out there in your 20s, 30s, maybe even early 40s, you may not yet realize it, but starting a family could be the biggest out-of-pocket healthcare expense that you face. Despite this large and growing market, today's solutions are only serving the 1%. IVF costs start around $20,000. There's limited insurance in the market. Treatment is complex, and there's no patient support outside of the clinic environment, leading to a really isolating and intimidating journey. I founded Future Family to bring fertility care to the 99%. We're a fintech company, and we make fertility care affordable and accessible to all women, men, and couples seeking to start a family. We uniquely bring together on our platform testing and planning resources to get started, affordable financial plans so that you can move forward with IVF or fertility preservation, concierge healthcare services, and access to our medical experts through an on-demand system. We launched the company back in June, and I'm excited to say that we're helping thousands of women and couples across the country with affordable egg freezing monthly plans, affordable IVF monthly plans, and our proprietary fertility age test, which allows women for the first time to order a simple hormone assay online and find out their fertility profile, their AMH, FSH, and E2, and get information that can help them figure out what are their next steps. But fertility is not just a women's issue. So on Monday, we were excited to announce our first test for men, the sperm activity test. We were even more excited when Anthony agreed to do the live demo. But really, let's go to our website so we can see just how easy it is to order the test online. You visit futurefamily.com and you have a choice, testing for women or for men. You can order the test right online, and we'll collect some identifying information, your name, date of birth, telephone number for your lab slip. Then, as you can see here, we'll ship you the kit in the mail, and it has all the information that you need to take your test, including instructions, an introduction to your nurse concierge, and a lab slip, which you'll simply take with you to the nearest participating lab, of which there are many options. Once you get to the lab, check in, complete the test. 3 to 5 days later, your results will be emailed to you, and then you can follow up on our platform with one of our nurse concierge staff members. Let's go back to the presentation. So for those men in the audience, a few questions to see if you might want to consider getting tested. Do you ever, and no judgment implied, binge drink, indulge in marijuana, maybe carry a cell phone in your front pocket, or use a hot tub regularly? These are all reasons to consider getting tested right away. Future Family doesn't stop there. We do fertility preservation and IVF affordable plans on the platform, as we mentioned. Egg freezing today is as expensive as $12,000 to $15,000 out of pocket, yet with Future Family, you could start a fertility preservation plan for $150 a month. IVF, even more expensive, starting at $20,000, is affordable on our platform at $250 a month, and sperm freezing is coming soon. A little more detail on how it really works. So you can sign up for a monthly plan that fits your budget. Then we'll help you match with a top clinic or doctor based on our in-house data set. You can meet your nurse concierge, who is a trained fertility expert with typically 8 to 10 years of fertility or clinical expertise, who will help you through the entire journey. Complete treatment, which for fertility preservation is about 2.5 weeks of active time, and then continue your membership on the platform. Bringing together fintech and state-of-the-art digital health, we have 3 revenue streams for the company: financing, concierge health, and testing. And although we are focused today on acquiring customers and building volume on the platform, we have a pathway to 60% gross margins in our financing product. We really sit at the intersection of fintech, telemedicine, and concierge medicine. Some of our competitors have taken a more specialized approach, focusing on employer programs and working with B2B partners, owning and operating clinics directly, or simply specializing in testing and informational services. We uniquely bring together this platform approach to make sure we can help you from the very beginning of your journey all the way through the end. With a total addressable market over $100 billion, this is a huge market. So sign up today, plan your future, and get tested. Thanks so much.
I don't think I've ever turned that red on stage before. Okay, judges.
How are you able to offer those services at a markedly different expense than what's the 1% might be pursuing?
Well, because we're a fintech company, so we're basically offering a financing plan for the services.
Okay.
So if IVF was $20,000 over a 5 to 7 year term, we could finance you for $250 to $300 a month. So really our core financial product is actually an unsecured lending product into the marketplace. But of course we bring all of the specialty health information that we also have.
And if you weren't going to do the fertility testing or the age testing through your platform, what's your other alternative? To go straight to your doctor?
Yeah, so we actually heard from a lot of women. We spent about a year in private beta, and there were women who had tried to get this test and were not able to get it from their doctor because for weird reasons it's not covered by insurance necessarily, and so doctors felt uncomfortable saying it was extra testing. So one of the things we're doing is democratizing this access to information.
Okay.
Yeah.
Is there a certain number of eggs that can be frozen or a certain number of cycles to try that it would be included in the plan, or, because that's usually one of the benefits that I'm seeing in some of the tech companies nowadays. And
yeah, that's right. So some tech companies are covering, if they're self-insured, are covering this as a benefit. Of course, that is really truly the 1% that's getting coverage today. So today we're really stepping in and partnering with the clinics who are offering these services, and so it's unusual to have necessarily a bundled service, but by making it affordable, we certainly help women and couples do multi-cycle when that's required, which, as you know, is a percentage of the time for sure. So does that answer the question?
So usually I think of a certain number of times that somebody tries an implementation, because as you know, it's a pretty involved process, pretty expensive.
Right.
So, and I'm just trying to wrap my head around when thinking of it as a monthly fee. Is there a way to translate that into this number of this number of attempts that somebody gets as part of the service, or is it just kind of unlimited?
Yes, certainly our vision on the platform is that as we have more volume, we can offer more sophisticated packages, meaning you might get a package that guarantees you a certain number of cycles or includes additional. For now, it really is a product that allows you to get started immediately because we're financing the cost of a single cycle. Okay. And then if you need a second cycle, you would re-up with a second plan.
Okay.
But certainly the vision is to offer more sophisticated packages for our clients.
Got it. Thank you.
So you talked about 3 revenue streams. So the financing that we were just talking about of the IVF and other longer term things, the concierge medicine, which I presume is sort of bundled in with one of your other services, or I don't know, and then testing, is that priced as sort of like a minimal gross margin as customer acquisition? So talk about your overall business model, where you see the revenue being over the next 12 years is 12 months as you're launching.
12 years.
12 years.
All right, 12 years.
It only feels like 12 years.
So exactly. So to break it down, so really there's sort of the top of the funnel approach, and that's where we're uniquely offering free consults with nurses and doctors on our platform, as well as testing services. You're exactly right, though. Those are top of the funnel tactics. And then we're actually pathing people into the right fertility plan for them. So testing is designed to be a low margin product, maybe a volume product, but ultimately a low margin product. And then the financing product product is obviously where we have higher margins. Concierge medicine is interesting because when we launched the platform, we envisioned that as part of what differentiates our financial product, that we pair you with this amazing nurse concierge who's empathic, has all the answers, and is digitally connected to you through your whole journey. And what we found was that not everyone being here in the Bay Area necessarily needed the financing packages, but people were willing to pay for the concierge services. So that's another monetization on our platform. But to be clear, the financial packages today are what's driving the volume on the platform.
Roughly what's your margin on a financial package, and what type of credit lending analytics do you apply up front before you determine whether you're going to take on a patient?
Yeah, so the first part, in terms of looking at the packages themselves, actually, let's start with the second part. So on qualification, it's sort of 680 credit and above, because you would imagine that ultimately we want to go down the credit spectrum, but today we're constrained by who will be our ultimate financial partners. So 680 credit and above, and we do employment income verification, so it's a very standard underwriting procedure. Remind me, Teresa, what was the first part of the question?
And so that was the question. And then just what's the margin
on
the financing product?
So today we're really optimizing for volume. But what's interesting is that you can think of us as sort of, we sell at retail, so we are never more expensive to a client than going directly to a clinic. But we are able to buy at wholesale. So we get discounts on the medications and the clinics that we buy from, if that makes sense.
Fertility seems like it has really, I think it's a great thing that it's gotten a lot more attention. Whereas maybe 10 years ago it was something that women and men didn't talk about, but it's kind of a hot space now, right? So there are a lot of consumer apps, there are some enterprise-facing services. It kind of feels like in terms of intellectual property or defensibility of the test or the service, it may turn out to be quite competitive, and it may come down to be branding and distribution. So how do you think about, because there are so many emerging and new fertility solutions being marketed to young couples and single women, what's the branding and distribution strategy?
Yeah, well, first I think it's really great that there are a lot of solutions entering the marketplace, and it's been an underserved market so far. And as my kind of last slide talked about, today there's about 200,000 couples that actually get fertility care treatment in the US, and there's 7.5 million at any one time that actually need services. So the delta's huge, right? I think testing and some of the other services that we're integrating, we are a platform play, so we look for best in class. And there's no reason we couldn't integrate other products and services, including genetic testing, into the platform. So we're not really looking to necessarily compete there. I think what differentiates us is really this ability to take someone from the beginning all the way to the end of their journey. You'll see a lot of companies that are specializing one piece of the journey, but not actually taking someone all the way through, and that really requires financing. And it also requires this concierge layer. So I think those are really important kind of differentiators for us. And needless to say, as a consumer company, we spend a lot of time focusing on what's the experience on the platform. And we've been live for about 2.5 months, and we just have amazing customer feedback.
Who are the concierge providers?
A wonderful and growing network of registered nurses who have experience in fertility. Typically, they have between 8 and 10 years of clinical experience. And as you can imagine, they're part of the workforce that actually wants to diversify and not necessarily be in a clinic job. Some of them have children. And so they are really part of a remote workforce for us. And then we, of course, have a technology layer so that they can connect with our clients digitally. So Skype, FaceTime, text, the whole thing.
Okay.
So.
And from the credit side, what is really proprietary about what you're doing so that any other credit provider can't just come in and start providing loans to people who are seeking IVF treatment?
Yeah, two things on what's sort of proprietary to us. One is obviously how we're evolving our underwriting criteria, which is also tied ultimately. An important factor is success rates, doctors under having that data at the clinic side, and we have that uniquely that other credit providers don't have because of our relationships with clinics and because of the fact that we're tracking success data from our own clients. So I think that data piece and the underwriting component is really important. The second piece is kind of what I mentioned to Kirsten, which is this idea of you're getting a financial product wrapped with a service. And we have really thought that was kind of the next generation of fintech, that you can't just compete on a commodity product like financing or money, but when you tie it to a high value service that makes people feel really good and ultimately potentially drives better outcomes, we think that is kind of our advantage in the marketplace. So.
Are you looking two things? One, are you looking into applying the data that you gather on clinics and have, given your relationships with them, and do you offer your users or want to offer them ratings on how good those clinics are? So if they're going to go to a clinic,
what was that?
If the user is going to go to a clinic,
right,
you tell them how good that clinic is at their job. In other words, pick from these 5, this one's the best.
Yeah. So we do have a growing data set on clinics and doctors. Importantly, those are 2 variables. So yes, we definitely provide information services and aim to do that. We still, though, have a strong consumer focus, so we believe ultimately the consumer makes the decision. So you don't come to Future Family and then get told what clinic to use, but you do come to Future Family and find out these might be the top 3 in your geo for these reasons, and then you can make an educated decision about where to go. Some people really care about bedside manner. Some people really care about, like, I want whoever's on the cutting edge, and there's a lot of cutting edge medicine and science going on in fertility
I prefer
now.
rude and effective, but other people may feel different.
Exactly. So, and we have a doctor for you.
Right. And then what about customer acquisition? Bringing those customers on, telling them what you do, and educating them about you. Is this a brochure in a clinic, or how are you bringing them in?
Yeah, so we have a sort of care delivery team that reaches out to clinics, but because of the launch a few months ago, we've also had a lot of inbounding from clinics, which I think it proves that this is a pain point, particularly when we move outside the more affluent areas that we're all used to, that clinics are looking for partners that can provide financing and other services. So we have a process for onboarding clinics, and then we proactively track the top clinics, and so we've then reached out to them around relationships.
So it's that opportunity when that person gets the news of how much is this going to cost, and you can see the light go out of their eyes, or now they have another option. Is that
right? And so those are the organic clinic referrals that we get, which is great. Is actually clinics that we haven't necessarily reached out to formally, but they've heard of us, and then they have a patient and they say, you should consider Future Family as an option. So.
I wonder, having had any number of patients who've gone through, this process, and any number of friends who've gone through it. As you stated, this is among the most emotionally challenging things to go through over an extended period of time. And I always wonder, we think of the concierge services and all the other stuff around the medical part. Is there any part of what you guys are doing that offers kind of emotional support, or kind of the other, surrounding pieces of it?
Yes, well, I'm about to say something that I hope doesn't offend too many people in the audience, but we find that the nurses really bring that empathic layer, maybe in a way that not even really high caliber doctors are necessarily trained to do. So we made a really conscious decision in the business model that we wanted to bring on a staff of nurses who not only could answer my basic fertility questions, because they're so expert in this field, but also could bring that sort of empathy. So I think that has a lot to do with who we hire into our care delivery team.
Great.
All right, we are out of time, so give it up for Future Family.
Thanks so much. Thank you.